Lomazzi. She's a PhD in sociology and social research. And recently she's working as senior researcher in the international study team of the Data Archive for Social Sciences at GESIS, GESIS Leibniz Institute for Social Science in Cologne, Germany. She is also part of the central team of European Value Studies since 2015 and acts as secretary of the executive committee of EVS since 2018. As somebody of you know, probably a team from the Faculty of Philosophy has joined the European Value Study project in the wave of 2008 and in the wave of 2017. Vera is also a member of the board of European Survey Research Association, and her research mainly focuses on the cross-cultural study of gender equality and gender role attitudes on the methodological challenges of comparative research. Today, we have the pleasure to hear her online lecture on the topic of impact of COVID-19 crisis on gender equality in care work, insights from the European Value Study. Vera, please start with your presentation.
Yes, sure. So thank you, Antoanela, and thank you all of you for joining this talk, and thanks a lot to the Faculty of Philosophy for inviting me to talk of a topic that is part of my research. In this talk, I will talk about gender equality in care work. So I will give you some information and some more, so some definition of what we mean with care work. And I will try to look at these two different perspectives. So taking account both what happened to the individual level, so what are the differences between men and women in care work, but also to consider this aspect with a broader overview, taking account also what happened in societies. So taking account, therefore, both structural and cultural elements. And this is important to figure out or to start reflecting what could be the impact of the crisis that now we are all experiencing what COVID-19 means for our directly in our lives. But we have to be aware that in the coming years there will be probably a crisis, an economic crisis, and how these impact and there's a gendered impact on many aspects of the life of the people and of society. But before starting and going really in detail on the topic of the presentation, I would like to simply introduce the things that is, okay, now I'm going to talk about gender equality and inequality in care work, but this is not the only aspect that can have a gendered impact. So there is an institute at the European level, that is the European Institute for Gender Equality, that are already collecting a lot of studies, information and indicators on the different aspects that can be affected by COVID-19 crisis. When we talk about gendered impact of something, so a phenomenon like a crisis, or in this case, the COVID-19 crisis, we mean that the impact of this phenomenon can be different because of gender. So because every person has his own experience based by gender, and this can have a different impact of the same phenomenon just because of the gender. So this is very important, because all things that we are talking about when we talk about gender equality and gender discrimination and these things have this kind of details that we have to take in account. So these are the 6 domains, but we're going to talk about care work, and in care work. We have different aspects that I will talk you more, but what I started to ask myself during this time is that if the gender impact of COVID-19 is something that is really special. So we have read many articles in the press about how this crisis is affecting the households and the partners, how they are overwhelmed by the care activities for the children, for example, and everybody closing an apartment. So there is a lot of pressure. So it can see, or maybe in some readership that I did, it seems that it's something new, but it's not new. Not at all. So my question is it something really new, or we need to think that maybe there is already something there, maybe old challenges that have never been solved, and now this virus, this crisis, is simply putting a light on it, maybe because it's affecting not only women anymore. So this is my starting point of the talk. And now to go a little bit more in detail about care work, as I said, there are different aspects. So we need to distinguish between paid care work and unpaid care work. So paid care work is everything that is related to care. So we have different kind of jobs that you can see here in the picture. It goes from health workers like nurses, but also personal care workers in the health services, cleaners, but also childcare and elderly care, and so a lot of aspects. And you need to think that this economic sector altogether, if you look to Europe, so the whole European labor force, this sector represents the 21%. So it's quite a huge economic sector, this one. And the other aspect that is important to note is that it's also strongly feminized. What does it mean? So there is a phenomenon in the labor market that is called horizontal segregation. That means that there are some economic sectors that are gender characterized. So it means, like in this case, it's strongly feminized, so it's mainly women that are occupying this sector. Other sector, like engineer or other kind of figures that are mainly carried out by men. So, and you have to, for example, here you can see as some figures about this sector that the women make up most of it. So 93% of the childcare workers are women, as well 86% of personal care works in health services, and also 95% of the domestic cleaners and helpers are women. So this is a sector that is clearly strongly feminized. But this has also other characteristics. So now I think that in most of the countries in the last months, we have applauded nurses and the health workers because of the great job that they are doing. But actually, from the economic point of view, these figures are not that really taken account from the economic system. So actually, these are very devaluated jobs. And because in addition to the horizontal segregation that I talked before, there are other characteristics that converge in this sector. So one is called vertical segregation. So in this case, it means that despite the fact that, as you have seen, there are a lot of women in this sector, but the higher level positions are mainly occupied by men. So there is not representation of the workers of this sector. And then the other phenomenon is related to gender pay gap. Of course, this is not only a phenomenon for this sector. Actually, this is affecting all the women in the labor market. And this means, for those of you that are less familiar with these terms, it means that women and men have a different salary because of their gender, basically. So looking at Europe, the difference is taking account the hourly salary is 60%. So so out of 100 euro, women take 16 euro less. But then there is also another indicator that is the gender gap in overall earnings that takes in account also the time that is that people are working and the employment rate. So it's more a complex indicator. In this case, the gap is 40%. And the situation is worse for working women that have children below 6 years old. So they earn about 48% less than the men in the same situation, so with the children as well. So as you see, this is a condition. So this is a very peculiar and particular segment of the economic labor force. And affect many women. But again, I mean, this is not only due to COVID-19. This is already a situation that is existing. And then when we look to the other part of the care, that is unpaid care work, the phenomenon even more stronger. And I will focus the rest of my presentation on this dimension, because it's the one that I know a little bit more and is more related to my research. When we talk about unpaid care work, we refer to basically all the things that happen in our household. So how we manage that in terms of housework, so like cleaning, preparing the meals, shopping, these kind of things. And also the direct care, both of children and also of the more vulnerable member of the family. And also here, it probably doesn't surprise you too much. Caring is still a women's business, most of Europe. So this, it means that it's not only that women are doing more of the care activities, but you have to take in account also that, for example, we have the data only from population that is in the labor market. Okay, so both women and men that are working, and then you look to the time that they dedicate then to the housework or to take care of the children, for example, and then you will see that in addition to the time that is spent to the paid work, so the daily work, 81% of the working women are also involved on a daily basis, so every day in the unpaid care of children and other members of the family and the housework. And in contrast, only 48% of the men are engaged in the same way. But it's not only a question of frequency, but it's a question also of intensity, because even if you look to the people that are dedicating every day a bit of time, in addition to the paid work, to the care of the household, you will see that women spend about 4 hours, in contrast to men that is a little bit more than 2 hours and a half. And then there is also another differences in terms of type of care. For example, there are studies that tell us that while women are more involved, for example, in the terms of childcare, so women are more involved in routine aspect of care, so preparing the breakfast, making sure that the kids are arriving at school in time, these kind of things, while men are more occupied and more involved in recreational activity. So they are spending time with children, but on different type of activities. Then our couples discuss these things, our couples distribute the work to be done, so between paid work and unpaid work. So we can look, for example, at our data, other data that tell us something about the household care arrangement, care work arrangements. So who does what, okay? So in this graph that I will guide you to not get too lost in the many information that are here. So here I use the data from the ISSP, that is the International Social Survey Program. So it's another program in addition to the EVS. I will tell you more later. And here we can combine the information to find out the different types of arrangement carried out by the European households. So for example, in the right part of the screen in green, there is the percentage of people that live in a couple where they share almost equally a series of tasks. So for example, doing the laundry, caring for a sick family member, shopping, the cleaning of the household, and preparing the meals. Then in this dark yellow, we have the household, so the people that live in a family where is the man that is doing most of these activities. In blue, there are the people that are living in family where is the woman that is doing most of the things. And then there is a marginal group of people on the very extreme right of our screen that, that says that all these activities are done by another person. So what is important now to note in this graph is that, yeah, okay, we have a very different situation across Europe. This is a reflection of many things, values of the people, and I will tell you more later on what can affect this distribution. But here it's important to note that a traditional family model, that means the woman that is doing most of the things despite her occupation, her participation in the labor force. This is true for a lot of households, and even in the country that are normally considered as the more gender egalitarian countries like Denmark, Norway, Iceland, and Sweden, you will see that for more than half of the households, you have this traditional model. As I was mentioning before, so how the partner decide who does what. So normally this doesn't happen in an explicit way, like that the people sit on the table and say, well, I would like to do this, I would like to do that. So this really happens very, very rarely. Normally, this is something that is more an outcome of an implicit expectation about gender roles that came from a socialization process or the models that we have, that we had in our family of origin, and then we tend to replicate, and then we tend also to respond to to answer to the reciprocal expectation of the partners and also of societies. So there is a negotiation between gender ideologies, we could say. But then also the households employment patterns and the relative economic resources that are available to the partners also provide the partners with a different bargaining power. So you can negotiate more if you're a little bit richer, if you understand what I mean. So, and then, but this kind of mechanism and interaction take place in a broader context. That is a context given by society, where we have structural and cultural components. And then it means, for example, all the opportunities that are given by the family policies, and that normally the societal gender norms that tell you if something is acceptable or not, and then you tend to respond to that kind of legitimation that you can have. So talking about the structural aspects of societies that can be relevant, I'm thinking in this case in particular to family policies, for example, because the institution, through their practices and through their policies that they put in place, they also have a sort of normative value. So, and this is valid also for gender norms. So what does it mean? So let's make some examples. So for example, what kind of family a policymaker has in mind when they are making some kind of policy, or they are implementing some kind of policy? They are thinking to a family where both of them should work, or they are thinking to a family where, yeah, okay, if the woman works, it's okay, it's more money for the family, but actually I'm thinking more to a family where it's only the man that is the main breadwinner, that I was called. So of course, when institutions have their own gender norms, and they transmit them through the policies they implement. So let's make an example, for example, with the parental leave schemes. So there are very different situations. Now I mentioned two cases. So for example, in Italy, father can stay at home a very few days. So in terms of paid leaves, it's only a few days. Then you have a different situation, for example, in Sweden, where they can stay at home paid for months. So this is, of course, a different message that you are transmitting to your country and to the people and to the families. So which kind of values are you transmitting? And then furthermore, there are also there are studies that have investigated a bit if, okay, but does it really mean something, or is just something that we like to say? Oh, actually, it means something if you stay at home, if a father is more involved for a long period. So there are studies that investigated the length of the parental leaves taken by parents, by fathers. And then there is really a correlation that you can see that when the fathers are more involved for a long period, when the baby is very young, then they keep to be engaged and so in the housework, and also more involved in other aspects of the childcare, even when they turn back to work. And this is important also for the children, of course, because they experience a different relation, different parenthood. So there are many aspects that interact and have an impact, not only on in terms of gender equality, but also in family well-being, for example. But then there are also other aspects that are important. I already mentioned this because also in the structure, so in the policy, you have this aspect, but there are also other cultural aspects, so values, that are very, very important. So most of the current inequalities that we see in about gender, they come from an historical pathways. And also the cultural devaluation of care as an historical roots in the very old economic distinction between what is a productive work and an unproductive work. And from that distinction then became in place a cultural devaluation of care. And then when you devaluate something, you pay less for that. And then we go back to the initial argument about gender pay gap, for example. But then in Europe, we have different, in Europe and in the world, of course, we have different gender cultures, and they are shaped by the historical, economic, political, and social pathways that the country and the societies have worked through. Why these aspects are important, why culture is so important, why values are so important. But first of all, because this is something that we can work on it. I mean, in terms with education, for example, and socialization to gender norms and to gender roles, values have a really important place here. But also, we can use the information that we have from studies like the European value studies that give information about the cultural meaning of gender roles, because these can give us some insights on the cultural aspect where the future crisis may nest. Because as I said in the very beginning, now we are experiencing like the emergency that probably is calming a little bit down in this precise moment, but we don't know really what is going to happen and what will be also the economic outcomes in the coming year. So we need to be aware that could be the risk of a future crisis, and their values can are important to take in account, and I will show you soon why. So in the European value studies, that is a study that is carried out every 8-9 years in the geographical Europe, so it's more than 40 countries that are included. And it investigates values in different domains, and there are also some questions about gender roles and families and these kind of things. And here we have data, and I would like to thank the EVS team in North Macedonia, because they gave me the possibility to anticipate some results, because officially data from Macedonia will be released publicly next week. So now we anticipate, so thank you for this. But this can give us an idea of what people think. For example, how does it work? This question is a statement, and then people, so the respondent give their degree of agreement with this statement. So the statement here was, when jobs are scarce, men have more right to have a job than women. So this is a situation that could be, so when there is a crisis, an economic crisis, fewer jobs, who should have the right to get it? So, and then here people, and this question has not been asked 2 weeks ago, so some months ago, so before the COVID-19 outbreak. So this is the situation, the cultural situation that were already in place when the outbreak took place. So, and then here you see different situation by the countries, and then let's say that we could have 3 main group of countries. So on the left side, we have a country that says, well, no, I mean, the right to have a job should be equal. So both for men and women shouldn't be this kind of bias. Then you have a middle group in the middle, but it's still it's about 1/4 of the respondent that says, well, yes, I think that the man should have the priority. And then there is the side on the right that are that they show the countries with the percentage, with the higher percentage, where people say, well, no, actually, if the jobs are fewer, men should take them. So here you have already some information. And another question that I want to show you, there are more questions, of course, but I picked only 2 of them. And the other one is this one. So a man's job is to earn money, and a woman's job is to look after the home and the family. So this is a very strong statement about what we were saying during this talk. So should women stay at home and take care of children, and that's it? And yeah, well, here you see more or less the same distribution. So this tells us that there are a little bit these different gender cultures in the country, but again, you can see like 3 main groups with a group of countries on the left saying that, well, the distinction is not that strong, there should be some flexibility, we don't believe in a so strong segregation. Then we have a middle group that please look at the number. It's about 4 on the average is 35%, but let's say that is about 4 out of 10 people saying that yes, this should be the real distinction between men and women spaces. And then you have quite a huge group on the right that says that is, I mean, half of the population there saying that yes, actually this should be the distinction that should be in place. So you see that there are very different gender cultures in these countries, but this could give insights in the moment that we are thinking, okay, what can we expect when there is a crisis? What we should support more? What we want to make in place to avoid and to challenge also traditional gender roles. So my question that was already anticipated in the very beginning of my talk is like, okay, but is COVID-19 to blame for situation of gender inequalities? Well, I don't think so. I mean, during the lockdown, yeah, countries have applied a variety of restrictions, which often have implied to people to work from home and suspending the work activity. This, of course, give a lot of emphasis on the big commitment that family has to deal with, to combine care and work demands. But what institutional measures have been taken to support this for both parents? So these are the kind of questions when we want to do something different. But now the things is also this one. So, but what measures have been taken to support the return of both parents to work? So in some countries that are releasing the restriction, so they can go back to work, but in some countries they didn't open the school. So what is going to do there, the family that have children in the school age? So gender inequalities in unpaid care work are not due to COVID-19. I mean, they were already there, and the emergencies, like other emergencies, are just highlighting the weakness, both in structure and also in the cultural background that were already there. I mean, and day and light that we are seeing from the graphs that I show you that are already existing almost everywhere, traditional gender roles. So I'm sorry, but we shouldn't be that surprised if women are and will be more affected than men by this crisis, or if working mothers in Europe will be more exposed to more risk concerning job insecurity, lower salaries, or employment segregation, because it was already there. I mean, it was already so. We have seen it from the data, so we know this. So what is happening is only that these inequalities are getting bigger. That's the risk that we have to deal with it. So it's not that we were in a condition of equality and now there is a big mess. No, it's only getting worse. So to give a bit of hope at the end of my presentation is, but can this crisis also be an opportunity for gender equality? I would say yes, if we use the knowledge that we already have. So, and which knowledge? What we know. So we know that inequality were already there, but we know also that pre-existing gender inequalities risk to increase. So that's one of the dimensions where we have to act. But we also know what happened with the past economic crisis, with the previous economic crisis after 2018. So Europe and the national government decided for austerity measures. Of course, they were probably necessary to deal with that times, but they didn't take in account the gender and the impact of this measure. So what happened is that a lot of work-family balance policies were cut, and a lot of gender equality policies were cut. So, and also all plans, for example, for childcare and for elderly care in countries like Spain and Italy, they were postponed. So something we know from the previous mistake. So what has been done and what and the situation that we have seen probably is the result of that decision. So the same mistakes could be avoided, and they take in account the gender impact of the crisis and also the institutional measure that governments and organizations want to put in place. And in particular, policymakers should consider the intersection of inequalities, so not only gender, but also the different inequalities, and giving value to care work and extending the attention to childcare, to long-term care, because remember that we are in an aging societies. So the problem related to the long-term care will be always more and more important. And then another aspect that I think that is very important is to think policies as a packages and not just a temporary measure. So we don't need a symptomatic answer. So it's like when you have a pain and then you take a painkiller. Yeah, that's fine. I mean, then for that day and then the day after you are happy. But then what happened the day afterwards? Then maybe the pain come back again because you didn't solve the origin of that pain. So what we need for gender equality, especially in care work, we need a systematic strategy. That's why I'm talking about policy in packages. So with this, I think that I went through to my presentation. So I'm open to feedback and question or anything. So thank you.
Vera, thank you very much. So can you please remove your presentation from the screen so that I can see the answers? Okay. Okay. So thank you very much. And I completely agree with you that COVID-19 is one current and very important issues, and it is revealing already existing weaknesses and risks, and it's amplifying them, and that structural and cultural aspects are very relevant in this perspective. But I also think that we will be facing more crises, more questions that are sociologically interesting in any kind of balances between, you know, otherness, like religious one, like social class or ethnical, etc., considering especially the cultural aspects. I will try to see if we have some questions. Yeah. Okay, we have.
Thank you. Thank you, Violetta.
No questions in the moment. Just maybe one from Konstantin Minosky, that you already know. How you can comment free reproduction of gender roles? How you can comment the reproduction of gender roles? Traditional way of reproduction of gender roles, because we have that that situation in Macedonia, and we are seeing that mothers and grandmothers are just reproducing the gender roles, you know. So that's one of the most interesting and most challenging questions in gender issues. I know, but yes, please.
Yes. No, I mean, I I don't know very well the case of North Macedonia, but in general terms, I'm also thinking to Italy, that is a country that has very traditional ideas about gender and gender roles. I think that this is a very important issue. I mean, I think that it's true that if we want to talk of revolution of gender roles, most of it has to go through these woman lines, so from mother to daughter, but that's on the other way around. I mean, daughters also should try to be more aware of the mechanism, and I think on this, from this kind of view, education is one of the main aspects that give how to say the tools to change, to make some changes. But I don't know. I mean, it's also a question really by women and women. I mean, it's like also what we do in our couples, so in the families, what we do, what we allow to do. I mean, now I'm really thinking to stupid things of daily life in family, or when you have kids. So if you have children that are, let's say, men and so girls and boys. So which are the tasks that you are giving to one and to the other one? They are the same, they are different. Why are the same or different, for example? But that's if you think to couple. I mean, it happens to me many times, and it's also challenging for myself and also for my friends. When we talk about this, it's like when our husbands are doing something, it's like, oh no, you're not doing in the right way, I show you. And this, I think, that is very counterproductive, because it's not the way. It's not the way to go. I mean, if you want to change a gender relation, you need to accept both the way of doing things, and should be kind of reciprocal help in this change.
Thank you very much, Vera. Well, from our data from the EVC, we also can see that the attitude of Macedonian citizens is more traditional than contemporary, let's say, towards marriage, towards the role of men and women in the family. But there are some differences, statistically significant difference between the attitudes of male and female Muslims and Christian Orthodox Albanian Macedonians, older than younger rural population and city population, but less educated. Of course, they're more traditional. But problems with divided families, elderlies, etc., is also a problem in this pandemic. What do you see how it is managed in various countries? How you can provide help for the elderlies that are in the family and outside, physically outside the family, outside the household, and also. Is maybe the limited space that we are caught in the quarantines, like small apartments or houses with more than one family or more than one generation living in the house, you know, and taking precautions in the same time to save the social distance. It's not possible at all.
Yes, this is what I meant when I was talking about taking account the intersection of inequalities. No? Mm-hmm. So, of course, this the quarantine that we experience across Europe, but even within the same country, within the same city, it's very different, family by family, because as you mentioned, I mean, if you have a big house with a garden or a balcony, is totally different than living the quarantine in a small apartment with only a window, and then maybe you are in 4 or 5. So this, of course, is the interaction of inequalities, but things also to what it meant for families with children that has to do on school from home, and maybe they have only, if they have internet access, because this is so, a lot of policies give this for granted. but not in all the area of a country the internet is available. Not for all the families available. Not all the family have more than one device. So there are all this kind of situation that. So that's really important. So when we have to think about the impact of the institutional measures, that's what I meant with taking account the intersection of inequalities. Because of course, if you are in a family where lower access to economic resources, so you don't have the technical instrument, the physical, material instruments to get online, for example, and then plus you are also a girl, and then you maybe are part of a minorities, then, I mean, this altogether became really problematic, you know, to deal with.
Absolutely. So we have two more questions, please. The first one is, do you think we are taking the right steps towards making the situation better? By we, I mean we as human societies, countries. And will this COVID crisis take us a couple steps back from where we used to be in the terms of gender equality in many fields? So just signed by Martin. Do you want me to repeat the question, or it's okay, Vera?
I don't know if I got it, but I'm thinking, what is the impact of this in our field?
Do you want me to read the question once more?
Yeah, thank you.
Do you think we are taking the right steps toward making the situation better? By we, I mean we as humans, societies, countries. And will this COVID crisis take us a couple steps back from where we used to be in terms of gender equality in many fields?
Yeah, I think that the risk that we are going back is there.
Yeah.
And I don't know if we are taking the right steps. I think that unfortunately we will see the results in the future. I think that this really depends by the country that you are looking at. So there are some countries that probably are trying to manage things in a more complete way, others that are just focusing on the emergency and just thinking, okay, you know, the example of the painkiller, they are just thinking which painkiller can be the most useful for now. And this is probably a problem of the politics, not only on this topic, but generally speaking. No? So look only for the immediate results as in terms of consensus, and then, yeah, the problem will come for other.
Okay. So the other question, there is one comment also, but just a moment, please. So the other questions from anonymous attendee is, have you compared results from previous EVS wave regarding attitudes on gender roles, and is there a change in attitudes? I think there is a little change, but in our country, it is not changing like dramatically. So, Vera?
Yeah, I didn't analyze yet in the long term the value, the data that we have. Of course, we have data since 1990, so this would be possible, but it's still ongoing. So we have the data available since last summer, but we didn't analyze them already because we are waiting to have the whole picture of all the countries. From what I saw, yes, there is a little bit of improvement. It depends also really country by country. It's really different situation, and probably these strongly differences is again an interaction between the existing situation and the implementation of policies that can have fostered or not more egalitarian attitudes.
Okay, thank you very much. There are not. There is one panelist that is commenting, but Violeta, can you repeat it? I don't see on my screen on question, maybe. Okay. We have 5 minutes from Violeta Panev to all panelists, just a comment, but Okay.
Okay.
Interesting facts. Nice presentation. From Ilo Trajkovski, our EVC fellow colleague, as you know, from the Faculty of Philosophy.
Okay.
Normally, he said, normally at this time I have my classes on rural sociology. I believe my students are also joining us in this webinar. For that, I would ask you if you could reflect on the issue of gender aspects of care work and coronavirus in rural areas.
I don't know much on this topic, unfortunately, but of course it's so I cannot say anything like having data or so about these, and I don't know really much about the situation in the rural areas. So I would go just for common sense. So maybe it's better.
Yeah.
Postpone the answer. Maybe I can investigate better.
Nothing is changing there for better or worse. So Violeta Panev also commented concerning the value standard survey questionnaire. It proves us the more collective values in the Eastern countries and more individual values enhanced in the Western countries. It's just a comment.
Mm-hmm.
European Union values in the start were liberate, were liberté, égalité, fraternité. They have been changed or transformed into more values categories. Some have changed, the other as well, according to the statistic. Mm-hmm. Just a comment.
Thank you, Violeta.
Okay, I'm looking. One more question from Martin. Is there a connection between secularism of the state and public attitudes, opinions about gender roles? It's an interesting question.
This is a very interesting question. Should be, huh?
It should be. Maybe the results from EVC are showing that I've already mentioned that there is an impact of secularity or religiosity among all system of values and attitudes of people. So, it's your brief answer. I believe we have one more question and not enough time, maybe. So there are not questions, and we must say goodbye.
Yes.
Thank you very much once again. Thank you for all that joined us on this webinar.
Thank you all of you for taking part to this talk.
Violeta Panev is a dear person. She said thank you and take care.
You too.